Step-by-step physiotherapy treatment for ACL injury. Step 1. Initial assessment. After an ACL injury, a physiotherapist will assess the injury's severity and swelling. Rest, ice, compression, and elevation are crucial. You'll likely use crutches to avoid putting weight on the injured leg. Did you know that ACL injuries are more common in sports like soccer and basketball due to the sudden stops and pivots? Step 2. Early rehabilitation. Focus on reducing swelling and regaining range of motion. Gentle exercises like heel slides and quad sets are introduced. The goal is to restore full knee extension and reduce muscle atrophy. Visualize your knee as a hinge. Keeping it flexible and mobile is key to a successful recovery. Step 3. Strengthening phase. Strengthening exercises for the quadriceps, hamstrings, and hip muscles are essential. Exercises like straight leg raises, mini squats, and stationary biking are common. Strengthening the muscles around your knee helps stabilize and protect your ACL during recovery. Step 4. Advanced training. As strength improves, more dynamic exercises are introduced. This includes lunges, step-ups, and light jogging. Balance and proprioception training help improve stability and coordination. Proprioception is your body's ability to sense its position in space. It's like your internal GPS system. Step 5. Sport-specific training. Gradual reintroduction to sport-specific drills and activities. Plyometrics, agility drills, and running patterns mimic the movements of your sport. Your physiotherapist will tailor this phase to your individual needs in sport. This phase is all about fine-tuning your movements to ensure you're ready to return to your sport safely. Step 6. Return to sport. Clearance for full return to sport comes after meeting strength, stability, and functional movement criteria. Ongoing maintenance exercises help prevent future injuries. Remember, patience and persistence are key. Many athletes come back even stronger after ACL rehab.